Ladies and gentlemen, please welcome Andrea Lamberti.
Thank you. I don't have the clicker, actually. I don't have the clicker, actually. Oh, here. There we go. Okay. It's an honor to be here. Thank you very much for inviting us. I'm going to speak to you today about some of New York City's research and healthcare institutions and how they're working to make a better public realm in their projects and development. New York City is a leader in biotechnology, in healthcare and biomedical research, and is an emerging leader in biotechnology industry. Aspects of the city which contribute to this status include a highly technically trained workforce dedicated to revealing biological and physical underpinnings of the highest quality of life. It involves the presence of world-class centers of care and research, governmental support at all levels, federal, city, and state, for the support of existing institutions, as well as support for the emergence of new and innovative organizations. And perhaps most importantly, an aspect of New York City's leadership centers on the possibility for collaboration and synergy that results from the different organizations working together on solving common problems. The physical form of New York City's biomedical research and healthcare organizations typically takes three basic forms. One is the academic medical center, comprised of a hospital or center of care and co-located basic research laboratories. The second would be biomedical research laboratories housed either at a university or within a standalone research institute. And the third would be commercial space, which is a burgeoning area of the real estate market now for space being made available for biotechnology companies. These institutions and companies are distributed throughout all the 5 boroughs of the city, with the greatest concentration in Manhattan, where several clusters have formed. And I'm going to be focusing in a minute on one of those clusters on the Upper East Side, where multiple institutions are located immediately next to one another. The scale of this overall enterprise throughout the city is massive, and its impact on the public realm cannot be underestimated. And these impacts range from straightforward frontage of university and hospital buildings onto city sidewalks, the presence of public spaces and plazas and parks available to the public, located either in front of or within university campuses and medical centers, and lastly, through public programs which actually invite members of the public into medical center and research university precincts to attend concerts and lecture series, and also to participate in educational initiatives. There we go. On the Upper East Side of Manhattan, the Rockefeller University is located immediately adjacent to Memorial Sloan Kettering Cancer Center and Cornell Weill Medical Center. And it's in close proximity to numerous other institutions, Cornell's new tech campus, Hunter College, Hospital for Special Surgery, et cetera. The Rockefeller University is one of the city's foremost biomedical research centers, one of the world's foremost biomedical research centers, and is perhaps most noted for its 24 Nobel Prize winners. The campus houses over 600 researchers in 75 different lab groups and about 1,000 staff. The campus evolved in 3 different waves of development since its founding in the early 20th century. And now it occupies the boundaries that you see here on this aerial photograph. The first wave consisted of a hospital and several research buildings overlooking the East River, completed in the first third of the 20th century. The second wave saw the introduction of social and residential spaces for the campus, as well as the construction of more research labs. And the third wave, which just recently ended, featured more residential buildings, more research labs, as well as several massive renovations of existing historic buildings. And in 2011, with the installation of a new president, the university realized that its research building stock was beginning to fall below the level that was necessary to maintain its leading status, and that some new research space would need to be constructed. And so they embarked on a planning process, and out of that process emerged several principles. And one of them was that the garden and landscape designed by Dan Kiley should be preserved and enhanced, and that it shouldn't be touched and given over to new development. And that if anything, a connection should be sought between that landscape and the river. And so in the air rights over the FDR Drive, a building zone was identified for a new research laboratory. And the idea of an Esplanade connection was born that would marry the project to the public access way along the East River. The river building will feature state-of-the-art lab space, and with its very broad dimensions, will give the researchers inside the building much greater flexibility to allow their physical environment to change and evolve with the needs of the science. And a new conference center will facilitate internal interactions on the campus and will also enable collaborations with Rockefeller's collaborators in remote locations as well as their immediate neighbors. The building is configured in 2 floors over the FDR Drive. A landscape roof connects the project back to the existing garden, and the Esplanade completes the connection of the building to the river, where the structure of the building comes down to grade. The Esplanade will offer improved space for cyclists and pedestrian in line with many of New York City's planning initiatives, and as well as a segregated zone for recreation and reflection. And a new sound barrier and extensive plantings will increase the park-like feel of the entire zone, which actually extends the full length of the campus and goes even beyond the building perimeter. And seating will allow for views to the river and enjoyment of the riverside for the public, not just for the campus. So, and in closing, we would just like to note that this is just really one example of how New York City's research and healthcare institutions are collaborating with community leaders and civic agencies to meet not only their own internal needs and accommodate growth to maintain their international status, but also to improve the public realm for the greater benefit of the city. Thank you.